What I wanted to do really was to kind of go through a whistle-stop tour of what I think are the main health and well-being challenges for children and young people. What are the positive trends that we've seen over the last 5 to 10 years in some health outcomes for some children and young people. To look at some issues around health inequalities and variation. To look at what Public Health England intends to do about all of this. And how it intends to approach the issue of health inequalities and poor health outcomes. And then to touch on, throughout the presentation, on the role that I see that you have to play in that movement. If there are three things that I'd like you to try and take away from my presentation, it's these three things. The first thing is that you're centre stage in improving health outcomes, health and well-being outcomes for all school-aged children. I can't think of another profession, including teachers, I can't think of another profession where you have such a great tactical, operational, functional and strategic role to improve outcomes for young people across England. I can't think of a single profession. If someone can think of one, please tell me afterwards, but so far I've not been able to think of a single profession. You're centre stage. Which with that comes huge responsibilities. The second issue that I'd like you to take away with you is that you have tremendous support at a national level for what you do and the journey that you're on around modernisation and working in a new context, whether it's social media, whether it's working more closely with local authorities and other partners, working across services. And you've got two really passionate supporters at a national level in the Department of Health and Public Health England. Wendy Nicholson here, I sometimes feel like I have to wear a tin hat because although I'm on her side, her passion for what you do erupts at virtually every meeting that I go to. And it's fantastic because we need that sort of passion in the room when we're having these discussions. And, you heard that earlier about the extra capacity that will be needed to deliver some of the new things that you're being asked to deliver over the coming years. So that's really important. And obviously within that, Viv Bennett, who works across both Public Health England and Department of Health, is absolutely passionate about what you do, what health visitors do. Not a meeting goes by that I'm at with Viv where she doesn't refer to the importance of your roles. And the third thing that I want to say is that in terms of your importance is that children, young people and carers, their families, value what you do. The table that Wendy bored you with earlier, in terms, because she's used it several times before, which highlighted the challenges that children, young people and their carers said that they wanted more of. The issue was that they wanted more of you. They didn't want less of you. They didn't want to do away with school nursing. They didn't want an alternative model of provision. They wanted more of you. And I think that's a really important thing to hold on to, and certainly important for people like Wendy and I working with government departments.